Hypothyroid, symptoms and causes. So you're wondering whether you might have a thyroid problem. Maybe you suspect that you have hypothyroid or an underactive thyroid, or something's going on with that thyroid of yours. Or perhaps you have already been diagnosed with hypothyroid. Or perhaps you've been told that everything is normal with your thyroid tests, but you suspect otherwise because you're still not feeling great and you've got some symptoms going on. So I'll discuss some more important things in regards to this as well. So let's talk about hypothyroidism, symptoms and causes. Hello and thanks so much for joining me. My name is Michelle Cooke, period and hormone naturopath. And I basically help women struggling with their menstrual cycles have easy, pain-free periods, hormone balance, and emotional well-being. Sorry about that. I think my brain is absent from today. So I am a period and hormone naturopath and natural fertility educator and a naturopathic emotional release practitioner. And I'm the founder and director of Reproductive Wellness, which is a clinic located in Melbourne, and I see patients online and face-to-face. So if you have any questions or comments as we go through the live today, be sure to pop them in the comments box down below, or you can always just pop them in later, or if you're a bit shy, you can send me a DM or a PM, and that's totally fine. I'd be more than happy to answer that for you. So let's get started. Hopefully my brain doesn't fail me. So what does your thyroid do? Let's start with that for a little bit of background. So your thyroid is a really cute, small little butterfly-shaped gland that sits at the front of your neck, and it produces thyroid hormones, T4, which converts into T3, which is your active thyroid hormone. So why is it important? Well, it's so important for so many different reasons, and I love talking about the thyroid. So it's important for things like regulating temperature in the body, growth, development of the human body, metabolism. So it controls the speed of your metabolism. What does that mean? It's how your body converts the food into energy, okay? And it's that energy is what the cells, so every cell in your body uses that to actually function. It also is important for the cardiovascular system, so it's involved in heart rate. It's involved in the amount of blood your heart pumps through your circulatory system throughout the body. It's important for breathing, for digestion, and how, in terms of digestion, it's important for how quick or slow food moves through your digestive tract and into your bowels, and how long it sort of takes for that to reach the toilet, like when you go to do a poo. So it's involved in the motility of your bowels. So, and we need to remember that hypothyroidism or an underactive thyroid commonly presents with constipation. So there's a slowing in digestion there and a slowing in motility of that large bowel. It's involved in brain function as well. So for memory and concentration, it's very important. For weight management too, because as we know or may not know, hypothyroidism is actually associated commonly with weight gain. Not all the time, but generally. It's important for our nervous system because we need to remember that, with hypothyroidism, a common symptom according to the nervous system can be depression. It's also important for our reproductive health, our healthy periods and our hormone production. because it works on the metabolism and the development of the ovary and uterine tissue and the cells located within that. So we need to remember that thyroid hormones also influence the release of GnRH, which is gonadotropin releasing hormone, from our hypothalamus, which is located in the brain. And that will impact our girly hormone production, so things like estrogen, for example. So what is hypothyroidism? So it's when your thyroid is underactive, it's underfunctioning, and it's not producing enough thyroid hormones, so T4 and T3. So you'll commonly have low levels of T4 and T3, and you'll generally have high TSH, which is thyroid stimulating hormone. And that will kind of depend what the cause is of your hypothyroidism, because there's primary hypothyroidism and there's secondary hypothyroidism. So generally it will be high TSH, but it may be different if it's due to secondary hypothyroidism reasons. So what will happen is you'll have that high TSH, which will tap on the shoulder of your thyroid, and it will generally tell your thyroid to produce hormones. So it will tell it to produce T4, which converts to T3. So it will cause your metabolism to slow down when you have hypothyroidism. So normally, the hypothalamus located in the brain will produce TRH, so thyrotropin releasing hormone. And this will tell your pituitary gland, which is also located in your brain, to produce TSH, so thyroid stimulating hormone, which will tell your thyroid to produce T4, and then that converts into T3, which is the active thyroid hormone in your body. So that's what kind of you need in healthy abundance for things to actually happen in the body. So what are the signs and symptoms of hypothyroid or hypothyroidism? So things like feeling tired and exhausted, constipation, weight gain, dry skin and or hair, thinning hair, being very sensitive to the cold, cold hands and feet, muscle stiffness, tenderness, aches, pain, weakness, joint pain, heavy periods, irregular periods, prolonged periods, shorter menstrual cycles, no periods, and ovulation. So that's when ovulation doesn't take place. And decreased folliculogenesis. So that's basically the follicle development. And remember, each of your follicles contains an oocyte, which is an egg inside that follicle. So that's not happening properly. So that makes sense why ovulation doesn't take place as well, because it's impacting the development and maturation of that follicle. It can lead to things like poor concentration and memory. It can lead to depression, as I mentioned earlier. It can lead to goiter, which is an enlargement in the thyroid gland. And there can be shortness of breath as well, because it can impact your respiratory system. So what are the causes of hypothyroidism or hypothyroid? So it could be due to too much or too little iodine in your diet. So the thyroid gland needs adequate iodine to actually work and function normally and to work properly. So we need to make sure that we're eating things that contain iodine. So things like seafood and things like our sea vegetables, so nori, dulse, wakame, arame, all those kind of things. We need to be eating iodine sources daily for our thyroid to be working normally. And your body uses iodine to make T4, okay? So that's one of your thyroid hormones. And TSH will increase if your iodine intake is too low as well, because it's needing that iodine to make T4, but it doesn't have it there. It can also be caused by thyroiditis, so that's basically inflammation of the thyroid gland for some reason. It can also be due to Hashimoto's thyroiditis, which is an autoimmune condition where the immune system is dysfunctional and thyroid antibodies will actually attack your thyroid gland because it doesn't recognize that that's part of your body. So this will result in a reduction in the production of thyroid hormones as well. It could be due to congenital issues, so you might actually have been born with an underactive thyroid. It could be genetic, it could be due to pituitary gland issues or hypothalamus gland issues as well. So what are the contributing factors that will actually contribute to having hypothyroidism or an underactive thyroid? So things like stress, not having enough rest, or relaxation, or both. So if you're sort of burning the candle at both ends, work, not enough play, not enough rest, that can impact your thyroid gland function. Low-grade chronic acute infection, so you might have a bacterial infection, a viral infection, etc., and this can actually contribute to hypothyroidism. So can parasites as well. If you have that, that can actually contribute to hypothyroidism as well. Chemical exposures, so this could be at home. This could be things like herbicides, pesticides, agricultural runoff, consuming foods that are not organic. I know it can be difficult and it can be expensive, but doing it as much as possible is really, really important. If you can't afford to buy organic fruit and vegetables, make sure that you get a fruit and vegetable wash. So you can get that from health food stores. You just pop a few drops into the sink and really massage and wash your fruit and vegetables before you eat it to try and remove some of that herbicide and pesticide residue that's found on them. And then just give them a good rinse after that. Heavy metals can be another contributing factor to hypothyroidism as well if you've got high levels of them in the body. Or there could be poor elimination and digestion. So if things aren't moving through properly, if you're constipated, that can actually contribute to hypothyroidism as well as being a symptom of hypothyroidism. There can be an imbalance of bacteria in the bowels as well. So an imbalance between good and bad bacteria in the large bowel or the small bowel or both, and that can contribute to hypothyroidism. Leaky gut, so that's damage to the lining of your digestive tract. So for your large bowel and your small bowel, that's the lining, and it becomes inflamed and damaged from things like stress, poor diet, pharmaceutical medications and things like that can cause it to be damaged, and this can all contribute to having an underactive thyroid as well. So my thyroid was tested and my results were normal, but I still have symptoms. And I see this a lot in clinic. I have patients coming to me and they've been told that everything's normal, but they're still feeling crap and they still have symptoms of thyroid imbalance or thyroid disease or kind of heading towards that way. So there's 3 things to consider here. So it could be that your medical practitioner only tested TSH, so thyroid stimulating hormone. And I can't tell you how many times this has happened, and it drives me crazy that they do that, but part of it is to do with Medicare. So if TSH is completely out of the really broad pathology range, then Medicare will say, it's okay to look at T3 and T4. But if it's still within that massive range, it's not kind of covered by a Medicare rebate, so they'll often, they'll get a slap across the wrist if they do T4, T3, and it's not really warranted. But the thing is, your TSH could be normal, But we don't know what's happening with T4 and T3, which are your actual thyroid hormones. So we don't know what's happening with them. So TSH could be normal, but T4 and T3 might be abnormal, but we wouldn't know. So if you looked at TSH and it's within range, you think, oh, things are looking pretty normal. But it's only one small part of such a huge story, and we definitely need to have those other two tested at the very minimum, so T4 and T3. And that's why you'd be told, everything's normal, because they've just looked at TSH. But please don't accept that as, okay, I'm all good, everything's okay with my thyroid, because it's simply not enough. We need more than that. So ideally, in a blood test, we want to look at things like TSH, T4, T3. We need to look at your thyroid antibodies as well. So TGAB, which is thyroglobulin antibodies, and TPOAB, which is thyroid peroxidase antibodies. We need to look at them. And we also need to look at urinary iodine levels as well. Really, really important. And I see that one missed quite a lot. And more often than not, the urinary iodine will cost you out of pocket, but it's only about $50, and it's very, very important for thyroid function. So we do need to look at that one as well, at the very minimum. Preferably, we want to be including reverse T3 as well, or RT3, because if you're stressed, your body will produce more T3 it will produce more reverse T3 instead of producing actual T3. And T3 is like the active thyroid hormone that your body needs to do things with, right? So obviously, if you're producing too much reverse T3, it's not going to be enough T3 for your body to be able to use. So that's another good one. That one is commonly out of pocket as well, but at the very minimum, the other ones would be definitely essential to look at. Now, number 2. So the other thing to consider if your results were normal, but you still have symptoms and you're feeling like crap. So a doctor reads tests very differently to a naturopath, okay? They're looking at results from an emergency room perspective. Is that person at risk of, do they have disease? Are the wheels really falling off the wagon? And they treat disease and symptoms. So the pathology range is quite broad for that reason. So if you're completely out of that massive pathology range, then they'll sort of act upon that. Okay, she's got disease, she's got symptoms, let's treat that. Whereas a naturopath will look at pathology tests very differently. There's the broad pathology range, but a naturopath will go, there's an optimal range between that massive range. And that's the ideal for optimal health, for preventing future disease, etc. We like to see between that. Because the thing is, if you're out of that optimal range, but you're still within the massive pathology range, you'll still feel like crap, you'll still have symptoms, etc. So we need to address that before it becomes a more full-blown problem, and quite often it already is. You're feeling pretty bad already, so we address it before it completely falls off the wagon. The third thing to consider, so if your results were normal and you still have symptoms, it could be that you've got subclinical hypothyroidism. So it's not full-blown hypothyroidism, so it's not that complete disease, but it's heading on the way there. It's making its way slowly to that hypothyroidism. So quite often when you have subclinical hypothyroidism, TSH might be slightly elevated, but T4 seems to be normal-ish, okay? So a little bit of a different scenario, whereas with hypothyroidism full-blown, you'll often have high TSH and your T3 and T4 will be a bit wonky. It will either be up or down. Usually it will be low. So that's what to consider if your results come back normal. Consider those 3 things, okay? So can a naturopath help me if I have a thyroid issue, or if I think something's wrong with my thyroid, or if I've been diagnosed with hypothyroidism? So the answer is yes, absolutely. So I would recommend seeing a naturopath, particularly one that specializes in hormones like myself, to support you. So regardless of whether you think something may be going on or whether you've already been diagnosed with a thyroid condition, either way, or even if you've been put on thyroxine for hypothyroidism, which is a common pharmaceutical medication used by a doctor for hypothyroidism, but you're still feeling crap, and there is good reason for that. It's very important to actually go and see a naturopath to help you feel better, to increase those energy levels and all the other symptoms that you're experiencing, because there's a lot more to it than simply giving you T4, than giving you thyroxine, which is a big dose of T4. Because the problem is if you are converting T4 into T3, that's an issue, okay? And you'll feel crap. You won't feel much better being on it, you know? So treatment-wise, what would we be doing together if we worked together? So we'd be using natural medicine, so things like herbal medicine, nutritional medicine, diet and lifestyle advice. I also use a technique known as naturopathic emotional release to work on any underlying emotions or stressors that are contributing to your thyroid condition. And generally speaking, I haven't found anyone yet that doesn't have underlying emotions in relation to a disease or their emotional health. So it's very, very important to clear that too, so that you're feeling better as well, and treating not just the physical part, but the emotional side too. So in terms of assessment, I'd be looking at things like nutritional deficiencies, which we spoke about earlier. Remember that if you're iodine deficient, that's going to increase the risk of you having an underactive thyroid or hypothyroidism. So we need to check urinary iodine levels through doing a wee test, basically, to assess your iodine levels. Then we need to look in the blood. We need to look at things like vitamin D, which is very, very important. It's anti-inflammatory for the thyroid and important for thyroid function. And we need to look at things like selenium and zinc, because both these are very, very important for the conversion of T4 to T3, which is your active thyroid hormone. We would be looking at things like hormonal imbalance, so looking at a blood test to assess your girly hormones, so things like estrogen, progesterone, FSH, LH, testosterone, all those things, because we need to gather a full understanding of what's happening there as well. Commonly, you may present with things, things going on with your periods and hormones. It would depend upon person to person what you're actually presenting with as well, as to what kind of testing that we do. Obviously, we'd be looking at the thyroid, so as I discussed earlier, we'd be referring you off to get pathology testing done to look at the full thyroid panel, not just TSH. So all those things I mentioned earlier, we'd be looking at those. And looking at gut health as well is really, really important. Remember, that's a contributing factor to an underactive thyroid. So we need to look at things like microbiome testing, which looks at your large bowel. It looks to see if there's an imbalance of good and bad bacteria there. What are the levels like? Is there inflammation? Is it impacting, different enzymes and things in the digestive tract? And making sure that we treat that so that your thyroid is kept happy as well. It may involve SIBO testing, which is small intestinal bowel overgrowth. So that's a test looking at the small intestine to see if there's an overgrowth of bad bacteria in that small intestine. And we'd only really be going down that route if you presented with sort of symptoms of SIBO, then we definitely need to look at that. We need to remember as well that if you've got an underactive thyroid or hypothyroid or hypothyroidism, this will actually slow down the motility of your bowels. So when it does that, it will actually increase the risk of you having things like sebum. So it's very, very, very important to rule that out if you've got symptoms of that. And if appropriate, looking at heavy metal testing as well. So if I think there may have been any exposures over your lifetime, etc., or if I think it might be a driving factor, we'd look at doing that as well, if appropriate. So do we have any questions while I'm here before I disappear this evening? If you're too shy to ask, you can always ask later or just send me a private message. But if you would like any support with your thyroid, I would absolutely love to help you. And I would like to invite you to a free discovery call. So it's 15 minutes. And basically, the call is to discover if we're the right fit, what would be involved working together, and any other questions that you might have. So it's a good way to sort of get to know each other first and what's going on for you. And if you're watching on Instagram, I will pop, there's actually a link in the bio for you to book that free discovery call. Or if you're watching on Facebook, I'll pop the link down below, and same with YouTube as well. The link will be down below too. And remember that all my Instagram and Facebook lives are actually on my website. So I always put this live video plus all the text underneath. So if you're quite a visual learner and you prefer to see the written text, I'll have that on my blog. So on Instagram, I've actually got it in the link in my bio. So there's a link to all my blog posts if you've missed any in the past. Otherwise, if you head to reproductivewellness.com.au/blog, you'll find them all there. And yeah, it's been an absolute pleasure. I really, really love talking about the thyroid. I'm very passionate about it, and I see a lot of thyroid imbalance in my clinic. So it's such a common thing that I see day to day. I think it's very, very important that we discuss it. And I would like to thank you so much for watching. As I mentioned, any questions, let me know. If you're watching on my YouTube channel, be sure to like and subscribe. And FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about periods, hormones, menstrual cycles, and women's health. So I look forward to seeing you next Wednesday. Thank you so much. Bye.